I'm Dr. Mark Grossman. I'm an emergency physician, and I'm the medical director of the emergency department and of EMS at Parkland Medical Center. And I'm joined here by some of our leadership in fire and EMS with our local departments to talk about calling 911 in case of an emergency, and it's what we're calling the Survive, Don't Drive campaign. Gentlemen, let's start by introducing yourselves.
Tom McPherson, I'm with the town of Windham as Fire Chief and Emergency Management Director.
Mike McQuillan, I'm Battalion Chief of Operations for the Londonderry Fire Department.
Doug Devine, Director of EMS for the Salem Fire Department.
Good morning, Chuck Hemian, Director of EMS for the Derry Fire Department.
And Eric Vandermaas, Assistant Operations Manager for Trinity EMS.
Okay, thank you. So one of the things we wanted to talk about is it's so important to call 911 in certain situations, and this is something that's interesting. I've actually never experienced this. I've been doing this for several years, where people drive themselves to the hospital even with a life-threatening emergency or critical emergency. So Chief, can you talk a little bit about different circumstances and scenarios where you would want to call 911, where it's important to call 911 and get that early intervention?
Yeah, I think anytime that anybody's experiencing difficulty in breathing, shortness of breath, chest pain without any relief after several minutes, anything that they believe is something that's a sudden onset that doesn't go away after a few minutes, should really seek medical attention and dial 911.
Okay. I would also add, if you're sick, if you've been seen by your doctor and you're being prescribed medication, either you're having an allergic reaction maybe to that medication, you're having an allergic reaction to anything, or you suddenly decline and decompensate and get worse despite being treated by your doctor, that those might be other cases where you'd call. And I would say for injuries, severe injuries, you're probably better off not driving yourself to the hospital. Because you don't know, blood loss and things like that could put you into shock and you may not make it to the hospital. So thank you. Some people think that driving themselves to the hospital, if they live close to the hospital, will get them faster treatment, and they don't want to call 911 because they think it will take more time for EMS to get there, pick them up and bring them to the hospital. So Chief, do you want to talk about that? Why is it not faster necessarily to drive yourself?
Yeah, absolutely. By calling 911, I think one of the first things you get is a certified emergency medical dispatcher through the 911 system that can actually give you medical instructions if you're having a heart attack, or if you're having any gross bleeding that's going on. And it immediately starts a system where the paramedics arrive in a very expedited manner to evaluate you. And they can determine whether or not you need to go by ambulance. When you're having a critical, life-threatening emergency, it starts our process to be able to communicate with the hospital and give them a heads up as to what's coming in. And it alerts them that if we have somebody that's having a heart attack, that they need to alert their cath team for a heart attack to go into the catheterization lab. If you're having a stroke, it allows us to notify the hospital that we're coming in with somebody who's going to need an immediate CT in CAT scan. And we have direct contact with the hospital, with the actual emergency physician and the nurses, to be able to start these processes. And the paramedics can immediately start life-saving intervention through IV and medications that we can give with all the tools and equipment that we have in the ambulance. And you have a team of firefighter and paramedics that are actually treating you in that period of time. So in reality, if you could drive to the hospital and get there 5 minutes ahead of us transporting you, that difference of that 5 or 10 minutes is lost because we haven't been able to notify the ER team of what's going on and what needs to be done for the patient when you arrive there in our care.
I'm glad you mentioned the dispatchers, because it's a lengthy and rigorous course, and some of the programs that are used utilize guide cards that have been tested and perfected and used with millions of calls, and they keep refining them. And what happens is, not only do they have that training, but they have these cards that say if you have this condition, to do this, and they can give you pre-arrival instructions even before any paramedic or EMT gets there. And those can be life-saving in and of themselves. They could do on-the-fly CPR training, for example. They are trained on how to provide that over the phone, how to help clear an airway if there's somebody choking or something along those lines. So that's an invaluable thing. I'm glad you mentioned that. Doug, what are some of the risks of not calling 911 and then driving to the hospital on your own, both to you and to others on the road maybe?
So obviously in these days, there's plenty of distractions out there for drivers. The biggest concern for us is that something might change. Whether it's you driving yourself or a loved one driving, obviously it's a medical emergency. The big thing is if you're driving yourself, something might change in your condition that distracts you or even impairs you from being able to drive. So a bigger factor is being able to actually get yourself to the hospital safely is kind of a big concern. And we've been through this a couple of before with having loved ones even following behind us. The big concern is that they're not thinking clearly, and so you might not drive like you should drive. And so our biggest concern is that you might get in a car accident or injuring yourself or even injuring other people. So we want to see you get to the hospital safe and sound.
Thank you. Eric, can you talk about the continuum of care from when 911 receives a call to the communication when a patient is being evaluated by paramedics or by EMTs and communicating with the hospital?
Yeah, absolutely. The communication really starts when the 911 call comes in. That information given to that dispatcher can relay that information to the ambulance that is coming to your house. So if there was even a sudden change before the ambulance gets there, we can get that information and bring the appropriate equipment in or call additional resources. Once EMS and the paramedics get there, we can do an evaluation and see and kind of just do a bedside triage on the condition of that patient. If it meets certain criteria, we're going to quickly alert the hospital. So if that patient is having a heart attack, we want to kind of do an early notification to the hospital with a STEMI alert and have the team ready for when we get there. Some of our transport times exceed 20, 30 minutes, so you never know what can change. Initial presentation says a patient might just be having chest pain, but our EKG is not showing anything. That can quickly change within minutes. So if that changes en route, if you're not in an ambulance, that hospital is not going to be ready for you. But if we're 10 minutes away and now all of a sudden you're exhibiting signs of a heart attack on our cardiac monitor, we can transmit that 12 lead to the ER physician, and you guys can relay that to your cardiology team, and we can provide further treatment, and now you guys are ready for our arrival. So any changes, that communication starts from the 911 through the EMS, and then we can notify the hospital, and really provides for the best outcomes.
I would say even some of the monitors that do EKGs and continuous monitoring while you're driving and transporting the patient actually have computerized algorithms that can sense that there's been a change in the EKG and then spit out a new EKG. It prints it automatically. Mm-hmm. So you're continually monitoring the patient for changes, which and then adjusting the treatment and again communicating that to the hospital, which I think is very important.
Absolutely.
So, Chuck, I want to ask you a question about the communication with the hospital and when a patient's being transported once they've been evaluated by the paramedics and the EMTs.
Well, thanks, Dr. Grossman. So that EMS provider and that emergency room physician have a very unique relationship. When that paramedic or EMS provider arrives on scene and they initiate their medical or their trauma assessment and they start to evaluate the patient, they make immediate communication with the hospital. The physician, the paramedic know one another, they give them all the information, and they'll advise if they need additional services upon arrival. For example, if someone may be having a stroke, they're going to clear and make ready the CAT scan. If somebody is has a major trauma or hemorrhage or bleed, for example, they may activate their trauma team and have all the available resources in the emergency department to quickly treat the patient. EMS and the hospital working together through good communication provides quicker and more effective treatment for patients. And we save lives in the end.
And I would say also that, I obviously agree with you, but we used to say the paramedics are our eyes and ears on the street, but it's so much more than that now. The interventions that you guys can provide, and girls, you're not only the eyes and ears, you're also our hands, you are our noses, most of our senses. I would say anything but taste. But, really, you guys can do interventions and save lives even before they get to the hospital. and those few minutes really make a big difference. So,
Absolutely does.
I have a follow-up question about stroke also. I was shocked to learn that almost half of our stroke patients that come to Parkland to get treated come in by private vehicle. They don't even come by 911, which, again, that's kind of a new experience for me, and I've seen it. So we also know, again, with years and decades of study on stroke patients, that time is critical. There is a life-saving and a brain-saving treatment that we have. That's a clot-busting medication we call TPA. That, again, we only have a very short window of when we can give it from the onset of the symptoms until we can give it to help resolve the stroke itself. And if you're beyond that window, we can't give it because it becomes too dangerous. So can you give an example of how important this is, that a patient being brought in via EMS and the collaboration with EMS and the physicians and the hospital and expediting the treatment and the therapy?
Absolutely, Dr. Grossman, and I think this is a great example of the importance of utilizing the 911 system. When an individual has stroke-like signs and symptoms, we would like you to think of FAST, face, arm, speech time, and T time stands for calling 911. And looking at Derry data last year and patients that we transported to Parkland and looking at Parkland data, I was absolutely amazed to find that 51% of patients having stroke utilized the 911 system, 49% drove themselves. Well, why is that a problem? Here it is. Patients who have strokes typically lose up to 2 million brain cells per minute. Patients that arrive by EMS, that they've pre-notified the hospital of a stroke alert, the CAT scan is ready, they're ready to receive the patient and initiate treatment. Door to needle time, and that's the time they get that clot-busting medication you had mentioned, TPA, was 47 minutes, which is great. That's outstanding. That's way above the curve for many other hospitals. What was very interesting to find was that patients that drove themselves, the door to needle time was 68 minutes. So what is 21 minutes? 21 minutes is 40 million brain cells lost, and we can't afford to lose 40 million brain cells. So the therapy is extremely time dependent. The sooner we initiate the treatment, the better the outcome. It makes absolutely no sense to me to say, I'm having stroke-like signs and symptoms, even though it may be painless, and in many cases it is. It's so important to call 911 and get yourself to the hospital. It activates a whole system of care prior to your arrival for the best possible outcome. Face, arm, speech time, T time, call 911.
And going even further than that, that 21 minutes may actually put you outside of the window where we can give that treatment, and that's one of the most disheartening and disappointing things that happens when a patient does come in and they're just at that 3-hour window to give the medication, but they're maybe beyond it. After 20 minutes beyond, we still can't give the medication because the studies show that it then becomes dangerous. It's really a cutoff that we have to be strict about. And if you lose that 21 minutes and you're outside the window by even a few minutes, it's really, the treatment becomes totally different. It's very disappointing.
And the outcome can be devastating at that point.
Right, because we're not treating. And then it becomes the same as we were doing in the 70s. Mm-hmm. Not that I was around necessarily. It is very important, and again, there are many examples of patients that come in by 911, they get treated and have excellent outcomes. And that window, again, could be lost or closed by the time you drive yourself to the hospital. Same thing with a heart attack, as Eric mentioned. If you're having a heart attack, it's not just getting to the hospital, walking through the door, being seen by a nurse, being seen by a doctor. That's not the only place where time is lost. In the time you're being transported, we have the EKG that's being transmitted by the paramedics. And then we call the cardiologist, the specialist, who's going to do an intervention to save you during your heart attack. All of that is lined up before you even hit the doors of the hospital. So we're saving not just the 28 minutes or whatever it is that there's a delay when you're not calling 911. We're also getting everything lined up for you in that time so we could treat you very quickly and get all the, again, it's the same thing. you're losing brain cells. With a heart attack, you're losing heart cells, and that never grows back. So it's very important to get everything started early. It's not just getting an EKG. It's not just getting a ride to the hospital. They're starting IVs. They're giving medication. They're giving oxygen and breathing support. And they're actually drawing blood for us that we then can send to the lab and have results very quickly. So thank you for that. I want to thank everybody for coming today, and everybody who's watching this and listening. And please, take this to heart. Over the past year at Parkland, the average was almost 30 minutes difference getting an intervention being treated if you drive to the hospital versus calling 911. And that doesn't include the time that the paramedics are taking care of you and initiating treatment. That's for us. That's the emergency personnel to take care of you in the department. So in the back of an ambulance, then you're also getting medication, getting the treatment that I was mentioning before. So if somebody is having what could be a life-threatening condition, you can call 911 and they'll give you advice on what to do, that it's definitely not safe. Let us come out there, evaluate you, and see what's going on. And Parkland has a Facebook page that you can look at, and we'll be responding to questions through there. Additionally, on the Parkland website, then you can look there and get more information. And I thank everybody. We have a great partnership here with our local departments, and we want to continue that and help save lives for our community. Thank you very much.